Welcome back to What the Study Says. All right, picture this. You've just come through a major surgery. You're in recovery, things are going okay, and then you see the nurse check the thermometer, and your temperature is creeping up. For literally decades, doctors have had a go-to answer for this. It's a partially collapsed lung, something called atelectasis. But is that actually what's happening? Let's find out. And listen, this isn't just some casual guess. This idea is practically written in stone in major surgical textbooks. I mean, look at this quote from a standard text. It states, as a fact, that over 90% of fevers in the first 2 days after an operation are because of this. 90%. That's a really confident number. And that, right there, is the big question. When a medical textbook makes a claim that specific, you'd think there's a mountain of rock-solid evidence to back it up. But as we're about to find out, when scientists finally went looking for that mountain, well, they didn't find what they were expecting. So how does an idea like this get so locked in that it becomes medical gospel? It's not just sitting on a shelf in a textbook. It gets passed down from senior doctors to junior doctors on morning rounds, it's taught in lectures, and it's even baked right into the clever little memory aids they use to train new doctors. If you've ever been to med school, you know this one, the 5 W's of post-op fever. It's a classic mnemonic to remember the likely causes. You've got water for UTIs, walking for blood clots, wound for infections. But what's number one? The very first thing you're taught to think about in those first 24 to 48 hours? Wind, atelectasis, the collapsed lung. So with this idea just everywhere, you can probably imagine it was a bit of a shock when some researchers decided to stop and ask a really simple, almost obvious question. Hey, where's the actual proof for this? It was time to put this dogma to the test. And that's exactly what happened in 2011. A group of researchers published what's called a systematic review. Now, this wasn't just another single experiment. A systematic review is like the ultimate investigation. They methodically hunt down all the quality research ever done on a topic and put it all together to see what it really says. After casting their net, they pulled in 8 solid studies that had specifically looked for a connection between atelectasis and fever after surgery. And we're not talking about a small sample size here. The data covered just shy of 1,000 patients across all kinds of different operations. And the results? Well, they were kind of a bombshell. Of those 8 studies they looked at, guess how many actually found a real statistical link between a collapsed lung and a fever? Just one. A single study. The other 7, they found absolutely no connection. The evidence just wasn't there. So where in the world did this idea even start? To figure that out, we have to jump in a time machine and go all the way back to a key animal experiment that seemed to prove the whole thing. This takes us to 1963 and a study involving let's just say, some very unlucky dogs. So here's how the experiment went down. Researchers blocked a major airway in 30 dogs, which caused part of their lung to collapse. And sure enough, every single one of those dogs spiked a high fever. Case closed, right? The collapsed lung caused the fever. Well, not so fast. Because when they looked closer, they found this thick, pus-like gunk in the collapsed lung, a sure sign of a nasty bacterial infection. And here's the kicker. When they gave the dogs antibiotics, the fever vanished, but the lung was still collapsed. The fever wasn't from the collapse itself, it was from the infection. Okay, so if it's not the collapsed lung, what is causing that fever right after surgery? Well, modern immunology has a much, much cooler and more elegant explanation. It's a concept called the danger model. And the idea is pretty simple. Your immune system isn't just a bouncer looking for outside invaders like bacteria. It's also programmed to act like a first responder, reacting to signals of danger from inside your own body, like when your own cells get damaged or seriously stressed out. And what is surgery, really, if not a whole lot of controlled damage and stress? Think of it like your body has 2 different kinds of alarm bells. You've got PAMPs, which are like the burglar alarm. They go off when a germ from the outside breaks in, but you've also got DAMPs, which are like the internal fire alarm. They go off when your own cells are injured, like during a surgery. And here's the thing, both of these alarms can send a signal to your brain, your body's thermostat, telling it to crank up the heat and start a fever. So this isn't just a cool science fact. This new way of thinking has huge real-world implications. It fundamentally changes how we should think about fever after surgery and what, if anything, we should do about it. Which, of course, brings us to this little plastic gadget, the incentive spirometer. If you've had surgery, you've probably spent some quality time with one of these. You're told to use it to keep your lungs open to prevent atelectasis and, you guessed it, prevent a fever. But if the atelectasis doesn't cause the fever, does this thing actually do anything for it? Well, the science on this is about as clear as it gets. A Cochrane review, which is basically the gold standard of medical evidence, looked at 12 different trials with over 1,800 patients. Their conclusion? Incentive spirometry does not prevent post-operative fever. It might have other benefits for lung function, sure, but stopping that early fever isn't one of them. So what we really need is a total mindset shift. And I think this quote from the journal JAMA Surgery just says it perfectly, that early fever isn't a complication we need to attack and stamp out. It's a normal physiological response to the trauma of surgery. It's a feature, not a bug, and it usually just goes away on its own. So let's just boil it all down to one key takeaway. That early spike in your temperature after an operation, it's most likely not a sign that your lung is collapsed. It's usually just your body's powerful natural immune system kicking into gear and responding to the stress of the procedure. It's a sign of healing. This whole story is such a great reminder that even the most deeply held beliefs in medicine have to be challenged and checked against the evidence. It really makes you wonder, doesn't it? What other medical facts that we all take for granted are maybe resting on some pretty shaky ground? What do you think? Let us know down in the comments. And hey, if you enjoyed this explainer, please don't forget to subscribe to What the Study Says. We'll see you next time.